Hello, everyone. My name is Ginny Ann Brown, and I'm the president of Medicare Navigators. I've been a licensed agent for over 30 years, and my company operates in 47 states across the country. Your company has partnered with us to provide you with unbiased advice and assistance enrolling in Medicare and Medicare plans. We're contracted with most major carriers, and our services are always provided free of charge to both you and your family. So let's get started with today's presentation. Today, we're going to be talking about the do's and don'ts of Medicare and common areas of concern. So in the last 15 years, we have worked with thousands of Medicare beneficiaries, and we've seen some common problems and mistakes. And we would like to try to help you avoid those. So please listen through the presentation. You can always visit us at the medicaresite.com. That's the Medicare site, site.com, and you can reach out to us there if you have any additional questions. I want to start by just doing an overview of Medicare for those of you who are not familiar with it. I'm going to explain the 4 general parts of Medicare, and I'll also talk about Medicare supplements, which are also referred to as Medigap plans. So the names Medicare Supplement and Medigap Plan are interchangeable, and they mean exactly the same thing. So first, we have Original Medicare, which consists of Medicare Part A and Medicare Part B. So Medicare Part A includes coverage for inpatient hospital stays, skilled nursing facility stays, hospice coverage, and some home health care. Part A is typically premium free if you've worked for 40 quarters, which is 10 years. So if you're married, you can qualify for premium free Part A based on your spouse's work history. If you were married for at least 10 years and now you're divorced, you will still qualify based on your divorced spouse's work history. Also, if you're married to someone and they die, you will still qualify based on their work history as long as you were married for at least 1 year prior to their death. By the way, you can also claim Social Security benefits from a divorced spouse as long as you were married for 10 years. So please keep all those things in mind. Most people do qualify for premium-free Part A, either based on their own work history or their spouse history. Next, you have Medicare Part B. Medicare Part B currently costs $174.70 per month. It can be higher if you have a higher income. Part B covers things like outpatient services, doctor visits, physical therapy, durable medical equipment, and some vaccines. And then we have Medicare Part D. Since Original Medicare does not cover most prescription medications, prescription drug plans are offered by individual insurance companies. Once you become eligible for Medicare, you're required to have a Part D prescription drug plan if you don't have other credible coverage, either through your employer or through the VA if you happen to be a veteran. And then we have Medicare Part C. Medicare Part C refers to Medicare Advantage plans. Medicare Advantage plans are also offered by private insurance companies across the country, and they pay in place of Medicare. Medicare Part C plans typically combine Medicare Part A, Medicare Part B, and Medicare Part D into a single plan that covers all of those things. Many Medicare Advantage plans typically have extra benefits that Medicare doesn't offer. So if you join a Medicare Advantage plan, it may have extra benefits such as coverage for vision, dental, hearing aids, over-the-counter products, and gym memberships. Some of them will even give you a robotic dog if you're lonely. If these types of extra benefits are important to you, then you may want to consider a Medicare Advantage plan, especially if all of your providers are in that plan's specific network. Also, there are many Medicare Advantage plans across the country that have no additional premium. In order to enroll in a Medicare Advantage plan, you do have to have Medicare Part A and you have to have Medicare Part B, so you still have to pay that Medicare Part B premium of $174.70 a month. But if you join a Medicare Advantage plan, there are many available that have no additional premium beyond your Part B cost. So that can be very helpful, especially if you're on a limited income. Your other option is to buy a Medicare supplement. Medicare supplements work with Medicare. As I mentioned, Medicare Part A and Medicare Part B, those are original Medicare, and they cover about 80% of your medical expenses. A Medicare supplement, for example, if you got a Medicare supplement plan G, like me, everybody calls me G because they can't say my name, that would cover most of the other 20% of your medical expenses. And then your only out-of-pocket exposure would be a one-time $240 Part B deductible. That's for 2024. So Medicare supplements work with Medicare. Part A and Part B pay first, and then the Medicare supplement pays second for Medicare covered services. Medicare supplements do not have networks. You have the freedom to go to any provider that accepts Medicare. Just keep in mind that Medicare supplements have a premium, and that premium typically increases every year. But if you want the freedom to go anywhere and see any doctor that accepts Medicare all across the country, then a Medicare supplement may be your best option. If you're comfortable being in a network and you already have a primary care doctor who refers you to any specialist that you see, then a Medicare Advantage plan might be the right choice for you. Next, we're going to go over enrollment timelines. Medicare has many enrollment timelines, and we do see people making a lot of errors and mistakes with these timelines. So please reach out to us and let us help you. There are multiple scenarios and multiple enrollment periods. There are very strict timelines, and there are penalties and repercussions from Medicare if you don't follow the rules. The very first enrollment period is the most common one. When you turn 65, you're eligible to enroll in Medicare, and then you have what's called your initial coverage enrollment period, or ICEP. That's going to be the 3 months before you turn 65, the month you turn 65, and 3 months after you turn 65. And just a side note here, if you happen to be born on the first day of the month, your Medicare will start 1 month earlier while you're still 64. So that's your chance to enroll in Medicare Part A and or Part B, and also choose a Medicare Advantage plan or choose a Medicare supplement and a prescription drug plan. Most of you on this webinar are still working. If you're still working now, it may be because your full retirement age is going to be at least 66 and a half. Many people are choosing to work past the age of 65 so that they can receive their full Social Security benefit. As long as you have credible coverage through your current employment, you do not have to roll in Medicare just yet. You can delay your enrollment until you're ready to retire, as long as your company is providing credible coverage. And the company that you're with now is definitely providing credible coverage to you. The next one is the Medigap Open Enrollment Period, or OEP. This is a very important timeline, especially if your medical needs are complicated or expensive. Once you get your Medicare Part B, whether you get it when you turn 65 or you continue to work until you're 70 and finally retire and get your Part B, the day that you get your Medicare Part B is the day that the clock starts ticking for your Medigap Open Enrollment Period. This means that you only get 1 6-month period to buy a Medigap plan with no underwriting and no pre-existing condition exclusions. If you miss it, you can still buy a Medigap plan, but you'll have to go through medical underwriting. If you are declined, then your only option would be a Medicare Advantage plan. Medicare Advantage plans do not have medical questions ever. You can choose or change a Medicare Advantage plan or a prescription drug plan each year during the annual enrollment period, which is also called AEP. That runs from October 15th to December 7th each year. So you can always join a Medicare Advantage plan later if for some reason you can't get through underwriting for a Medigap plan, or if the Medigap plan becomes too expensive for you to afford. And then last, we're going to talk about special enrollment periods, which are SEPs. And those are going to be things like leaving your employer plan, moving to a new state, or my current favorite, getting out of jail. Most special enrollment periods only last 63 days. If you miss that window, you're going to have to wait until the next annual enrollment period to choose a plan, and we don't want you to wait that long. People often ask us, if I'm turning 65, do I have to enroll in Medicare? If you or your spouse are actively working and you have coverage through your employer group plan, you don't have to enroll in Medicare. We'll talk through some scenarios where enrolling in Medicare might be the better choice than your employer plan, but this is a one-on-one discussion that we need to have with you to determine which option is going to be the better choice for you. There are only 3 groups of people who are going to be automatically enrolled in Medicare. The first one is going to be someone who's already on Social Security disability and they're under the age of 65. If someone is disabled and they've been receiving Social Security disability benefits for 24 months, they will automatically be enrolled in Medicare Part A and Medicare Part B, even if they're under the age of 65. Second, if you start taking your Social Security benefits at age 65, you will automatically be enrolled in Medicare Part A and Part B, and your Part B premium will be deducted from your Social Security check. And third, anyone who has end-stage renal disease and requires kidney dialysis will be enrolled in Medicare after 3 months on dialysis, regardless of age. Other than that, if you're still working with active employment, sometimes it's better for you to stay on the employer plan, and sometimes it's better for you to enroll in Medicare. Again, these are one-on-one meetings, and we're happy to have them with you. So this is what we don't want to happen. We don't want you to have lifetime penalties. We don't want you to have a lapse in coverage. We don't want to increase your costs. We don't want you to have coverage that you don't need. These are all problems that we see, and this is what we're trying to help you avoid. Once you have a late enrollment penalty from Medicare, it is a lifetime penalty, and once they are assessed, there's really no way to get rid of them. So again, contact us. We can help you avoid the penalties. This is especially true for people who have high incomes. We routinely see people enroll in Part B when they don't need it because they already have other credible coverage. That simple mistake can cost them $594 in unnecessary premium every single month. Credible coverage is the biggest mistake that we see all across the country. Keep using the phrase active employment. You must have credible coverage from active employment to avoid penalties from Medicare. So if you're on COBRA coverage, that doesn't count. If you're on a retiree plan, that doesn't count. Once you leave active employment, you only have an 8-month window to enroll in Medicare Part B. Please remember that. We have seen big problems with this across the country where people were on a retiree plan, 5 or 10 years have gone by, and then the company or the city that was providing the plan stops paying for it. And then those people must join Medicare Part B. When they do that, they find out that they have a massive lifetime penalty. If you miss your enrollment window for Part B, then you have to wait until the general enrollment period, which is called the GEP, to enroll. That's January 1st through March 31st each year. So that could leave you without coverage for several months. My best advice is to contact us as soon as you're considering leaving active employment. Now, all of you on this call are working for an employer that has more than 20 employees. But if you do have friends or family that are working for an employer that has less than 20 employees, those employees have to enroll in Medicare as soon as they turn 65. That's because Medicare is actually the primary payer for employees who work for a company that has under 20 people in it. There are also special rules for employers that have less than 100 employees, but that rule only applies to disabled spouses. If that situation applies to you, contact us and we can walk you through it. All of you are working for an employer with over 20 employees. Our next topic is going to be financial Medicare mistakes, and we're going to talk about 2 of them. The first one's called IRMA, and IRMA is not your mean old Aunt Irma. IRMA is the income-related monthly adjustment amount. And the other one is health savings accounts, or HSAs. So you're all learning a lot of new acronyms today. Welcome to Medicare. The first one, IRMA, is the income-related monthly adjustment amount. Most people who enroll in Medicare Part B will be paying $174.70 per month this year. But if your income as a single person is over $103,000, or as a married couple, it's over $206,000, you can pay substantially more for both your Medicare Part B and your Medicare Part D. So keep this in mind if you're in these categories. The chart shows the total premium for each income level. So find your income level to see how much you will pay for Part B and Part D. Medicare and the IRS are going to look at your tax returns 2 years prior to your Medicare enrollment. If your modified adjusted gross income, which is called your MAGI, is higher than these limits, you're going to be paying more for your Part B and for your Part D. If your income goes down because you've stopped working and retired, there's a way to appeal this IRMA adjustment, and we're happy to help you with the appeal paperwork. You may also want to keep these limits in mind when you're making decisions about stock options or salary deferrals. Just try to keep your income under these limits if that's possible for you. Now we're going to talk about health savings accounts, or HSAs. These are great vehicles for saving money for health insurance expenses, but you can't keep contributing to a health savings account once you enroll in Medicare Part A. If you have a health savings account right now, you are contributing pre-tax dollars to it. So those contributions will continue to be pre-tax contributions until you enroll in Medicare Part A. When you enroll in Medicare Part A, you must stop contributing to your HSA, or those contributions will become taxable. You can keep your account, you can keep all the money in it, but you must stop contributions. We personally recommend that you stop contributing 6 months before you enroll in Part A. And you should know that you're allowed to use funds in your HSA for Medicare Advantage plan premiums, Medicare drug plan premiums. You can pay your Part B premium and any IRMA adjustment that you have, your copays, your coinsurance, dental, vision, all of these things you can use your HSA funds for. The one thing you can't use it for is for Medicare supplement premiums, but you can use it for almost anything else as long as it's medically related. So next, people often ask us if they should stay on their employer plan or they should get off the employer plan and join Medicare instead. Again, every person is unique. It depends on your specific situation. What's good for your coworker may not be good for you. These are really individualized to each person, and we do not want you to base your decision on something that your coworker did or your spouse did. We do want to meet with you and talk you through the differences before you make that decision. Some factors to consider would be the premium you're paying, the deductibles and copays, and the network of doctors that you use. You also have to consider whether you have a spouse or other dependents on your employer plan that would lose coverage if you left the group plan. The most common thing that we recommend for people who do not have a HSA is to join Medicare Part A only. You can join Medicare Part A for free. So let's say your employer plan has a $5,000 deductible and you're hospitalized. If you just have the employer plan, you have to pay the whole $5,000. But if you have Medicare Part A, the Medicare Part A deductible is only $1,632 for 2024. So you can limit your out-of-pocket expenses going into the hospital as long as you're not contributing to an HSA. The other big factor for staying or leaving an employer plan is your prescription drug coverage. As you may know, Medicare has a donut hole or a coverage gap, and employer plans do not. If you're a high utilizer of prescription drugs, We do recommend that you stay on the employer plan, and we'll cover that a little bit more on the next slide. Medicare Part D prescription drugs. As I mentioned, everyone is required to have credible prescription drug coverage once they're eligible for Medicare. If you don't have the coverage, you'll have a lifetime penalty when you do decide to enroll, and nobody wants that. Medicare Part D coverage for 2024 has significantly improved. Previously, your out-of-pocket drug costs were unlimited, but that changed this year. Now, Medicare drug plans will pay $5,030 worth of drug costs. After that, you must pay 25% of the drug cost until your true out-of-pocket costs reach $8,000. After you meet the $8,000 threshold, you will pay zero for your prescription drugs. And in 2025, the law will change again. Everyone who is on Medicare will have their maximum prescription drug out-of-pocket cost limited to just $2,000 per year. That's a really big deal. If you're taking expensive prescription drugs and you're going to be on Medicare starting in 2025, you're going to get some relief for Medicare for those costs. Additionally, in 2025, you will be able to split your prescription drug costs into monthly payments, which will make budgeting much easier for those who take very expensive drugs. Next, I want to show you the two most common forms that we use, the L564 and the Form 40B. These are from the Center for Medicare Services, CMS. And these are the two forms that you're going to use if you decide to continue to work past the age of 65. The L564 form is filled out by both you and your employer, and it's going to disclose the dates of your credible coverage so that Medicare doesn't charge you a late enrollment penalty for Part B. The 40B is used to apply for your Part B coverage after you turn 65. Both of these forms are online and fillable, and you can submit them electronically. We're happy to help you or your HR director fill out these forms. We do see a lot of errors on these forms, so if you want us to double check your form before you submit it, we're happy to do that. How to enroll. If you don't know how to enroll in Medicare, it's really easy. The first thing you should do is set up your My Social Security account. If you don't have one already, you can sign up at ssa.gov. You can upload your documents and you can apply online. You can also pay your Medicare Part B premiums there. You can check your Social Security benefits. You can check your current enrollment into a prescription drug plan or a Medicare Advantage plan. All those things are available to you online. If you're not a computer person, you can enroll over the phone. You might be waiting on the phone for quite a long time, but you can do it. You can also go in person to a Social Security office. If you're choosing that option, I would highly recommend that you're the first person in line. Otherwise, you're going to have flashbacks to sitting through the DMV. You can also come and meet with one of our licensed agents. We can walk you through the process on how to enroll online, which is the fastest and easiest way. Medicare has been having some significant delays this past year with enrollments. So we are recommending that you apply 3 months in advance so that they can get your enrollment processed in time. The big message for today, don't do it alone. We're here. We can help. We'll help you climb up the mountain of Medicare. And why us? Well, we have years of experience, and it's hard for us to see people make the wrong decision. It's a lot easier for us and you if you make the right choices from the beginning rather than trying to go back and fix any errors or mistakes that might have been made. You can see up on your screen now, these are some of the employees that are here in my home office, which is based in Chandler, Arizona. I do have agents all over the country, and we also have many language skills on the team. So if you need a licensed agent who speaks Spanish, Vietnamese, Tagalog, Russian, or Arabic, we have agents who are fluent in all of those languages. Again, all of our services are provided to you at no cost, and we represent most major Medicare plans across the country. You can reach us on our website, themedicaresite.com. There's a lot of great information and blogs on that page. You can read all about Medicare and the latest changes. If you have any questions or concerns after the presentation, you can reach us by calling us as well. Our phone number is 480-821-9188. Thanks, everyone.